Objectives for Do One assignment is to analyze information a clinician needs for planning an electronic health record to manage a depressed patient based on their genetic information. Identify the information needed on first call to a clinic, first visit, between first and second visit in 8 weeks, and at your recommended time for subsequent visits. Identify the point in time when you recommend that the patient receive an antidepressant prescription. Describe who will receive the information and how this information may lead to change in prescribed antidepressant. Summarize the optimal business process your information needs assessment suggests. Here are 6 assumptions. Patient is first seen by primary care physician, which practice has HMO staff model. Patients and providers have access to email and internet. Patient is knowledgeable of his past medical, social, and family history. Patient is referred to psychiatrist. Patient has insurance. Patient has assigned pharmacy. Information that is needed during the first call to the primary care physician is patient's name, patient's date of birth, insurance information/verification, and reason for the appointment. Then the patient schedules appointment. However, during the first visit with primary care physician, information that is needed is the patient's demographics, and then the physician examines patient's social, family, and medical history, signs and symptoms, past mental health records, and then the patient informs the physician their reason for the appointment. The tasks that are done during the first visit is that the physician evaluates patient's condition. Based on a patient's signs and symptoms, the physician diagnoses him and prescribes him with antidepressant. The physician suggests a 1-week follow-up. The physician then orders the antidepressant to the assigned pharmacy. The assigned pharmacy receives prescription and patient is given medication. After 1 week, then the patient attends the follow-up appointment. During the follow-up appointment, the patient reports that the antidepressant is ineffective. There has been no change to his condition. The primary care physician then assesses the patient and recommends to see a psychiatrist. The primary care physician then places a referral into the system and the patient sets up an appointment for the following week to see the psychiatrist. The primary care physician then increases dosage on prescribed antidepressant until patient is evaluated by psychiatrist. During the first visit with the psychiatrist, the patient provides the following information: patient's demographics, insurance, patient's social, family, and medical history, signs and symptoms, past mental health records, and reason for the appointment. In conclusion, from the first visit with the psychiatrist evaluates patient and suggests patient to receive a genetic test to find the right medication for him. Psychiatrist orders DNA testing kit to conduct the genetic testing for patient, which will arrive in a week. Psychiatrist prescribes a different antidepressant. Patient schedules second appointment with psychiatrist. However, a week later, patient attends second visit with the psychiatrist. During this visit, the DNA kit has arrived and the saliva sample is taken and sent to the laboratory. The psychiatrist then suggests that the patient continues the same treatment, which is the antidepressant and talk therapy. After 4 weeks from initial visit, the patient has a third visit with the psychiatrist. Patient's personal information is reviewed and confirmed. Physician evaluates the symptoms that the patient is still experiencing and the progress with the antidepressant medication. Psychiatrist suggests to continue treatment and schedule another follow-up in another 4 weeks. 8 weeks from initial appointment, psychiatrist receives the in-review genetic testing results. The patient is prescribed an antidepressant that is compatible with his genetics. Prescription is sent to the pharmacy and patient receives medication. Results and treatment plan is updated in the electronic health records. Patient is to follow up with psychiatrist in 8 weeks. Appointment that is scheduled after the 8-week appointment. Patient has confirmed that conditions have improved. Treatment based off his genetic information, which were the antidepressants and the therapy, was very effective. This chart shows the information that was exchanged between the patient and the physician, between the patient and the psychiatrist during each visit. To summarize this process, it informs you what information is needed and when it is needed for electronic health records. I suggest that if the information is collected before the first visit, it will save a lot of time. And by having an updated electronic health record will also reduce a lot of steps.